do you have the program? Is it specifically for autism or other learning disabilities? And one thing I definitely want to ask about is ADHD, right? Like, because of probably the internet, everybody thinks that the child who's active is having ADHD, right? It's like people, those who like cleanliness, they have OCD. Similarly, child who's active is ADHD, and that's how everybody thinks. Like, I feel overdiagnosis is happening too much because of the internet. So tell me a little bit about the other conditions as well.
So now if you ask me, we are just trying to make them healthier. And this body is capable enough to solve its own problems. So whether a child comes to us with autism label or ADHD label or GTD label, we would not mind. Our job is to find out what all things are wrong in the body. We're just trying to make their body and system healthier and create those conditions so that body can develop normally as it should have been and take out the problems in the system. So all problems will start getting better. Now, interestingly, this ADHD case, which is becoming more common in the teens also. If you look at the gut health, many of them will be bloated. Many of them will have IBS kind of situation. Okay. And
the sugar overload, right? All the candies and everything.
So it is a diet they're eating causing the growth of certain microbes in the body, especially yeast and fungal and Clostridium infections, or antibiotic, multiple dose of antibiotics will cause more Clostridia in the system. That will impact their neurotransmitters. Their dopamine metabolites keep high and the calming metabolites becomes less. So if we can balance these neurotransmitters, either we straight away balance the neurotransmitters, you can give GABA or theanine to have more inhibitory neurotransmitters to balance the excitatory neurotransmitters, then some calmness will come, ADHD will get better. Or if you also alongside you change the diet, lifestyle and clean out these infections which are thereby affecting the neurotransmitters, you clean that out and ADHD is taken care. Is again not a problem for life. And most of the time what do? We give them a symptomatic relief. We give them some drugs, which is fine. Short term, it's okay. Any drug, short term emergency is no problem. But then emergency drugs becoming a lifelong drug is a problem. So rather we look at the problem and solve the problem.
Correct. Do you think, like, I don't know globally how it is happening, but do you think there is a need of school programs where we'll be able to screen the children at an early stage? Because we cannot go home to home and we are not able to go home to home and give vaccination. Do you think there is need, and that will solve quite a many problems if there are some school programs like this?
So I think yes, as the number of children are growing with the problem, this prevalence is scary. So yes, if teachers and school staff is more aware, they can inform the parents that something is wrong and you need to see what needs to be done further. But more importantly today, even if we get a label, what do we do? Most of the labels, same standard treatment that is given today is a therapy. That doesn't cut through. So it is also important that we educate our healthcare professionals. These are things that you need to be doing. Baseline food at least. I know in our medical system, we think diet and lifestyle is a joke.
There is no subject for nutrition.
Exactly.
We don't.
Right? Our bodies are made of the food, but nobody is teaching us that. It's not. Even if a tiny page.
It's not there. Even in biochemistry, we directly learn about protein, carbohydrate, all the cycles that are there, but we don't study what we consume. It's there in PSM, we do study little bit, but we study for malnutrition majorly or parasitic infection related thing. We don't. It's not a part of medical curriculum. It's not.
So at least our health, along with the awareness in the sense picking up the problem early on so that we can fix the problem early on, we should also equip our healthcare system. If a person comes to us with the problem, we should be able to solve the problem rather than being a standard game. Now it's diagnosed, you go to a therapy. Therapies are fine. It's more of a training system. No, but how much training you can do? If my brain is incapable to understand your question, to respond to you, you keep posting me 100 questions at 200 times, you keep telling me the same things, I would not, this is not getting registered to me because my brain health is metabolically poor.